Our next witness will be Dr. Russell Pate, who is the Associate Vice President for Health Sciences and Professor of the Arnold School of Public Health at the University of South Carolina. Dr. Pate is an expert in health implications of physical activity and youth physical activity. Dr. Pate currently serves on the Physical Activity Guidelines Advisory Committee within the U.S. Department of Health and Human Services.
My name is Russ Pate, and I'm an exercise physiologist at the University of South Carolina. I'm also a volunteer for the American Heart Association. I've authored several American Heart Association scientific statements, and I'm currently on the Department of Health and Human Services Physical Activity Guidelines Advisory Committee, having been nominated to serve in that capacity by the American Heart. Today, I thank you very much for inviting me to testify on the benefits of physical education and health education for our nation's children. And I'm thrilled, absolutely thrilled to be here today. And I hope that my remarks will help in the consideration of innovative ways to promote physical activity within our nation's schools and ultimately to prevent childhood obesity. The childhood obesity crisis in the United States cannot be overstated. As others have mentioned this morning, more than 9 million American children and adolescents are overweight, and the Department of Health and Human Services estimates that by 2010, 1 in 5 children in the U.S. will be obese. Unfortunately, it's well documented that overweight adolescents have a 70% chance of becoming overweight or obese adults. Obesity and physical inactivity are major risk factors for cardiovascular disease, some cancers, type 2 diabetes, and early death. We are already seeing diseases like type 2 diabetes, which we used to refer to as adult-onset diabetes, and elevated cholesterol in children that in previous generations were observed only in older persons. The epidemic is so severe that some experts have predicted that this generation of America's children may be the first to have shorter lifespans than their parents, and I'll say that that's a terribly depressing thought. The decline in physical activity in combination with adverse dietary trends is one of the most significant contributors to obesity and overweight among our children and youth. Recent findings from the National Institute of Child Health and Human Development confirm that physical activity levels decline as children approach adolescence, and I'll add that my own research group recently observed a large national sample of middle school girls, used objective measurement of physical activity, and found that on average those girls were engaged in about 22 to 23 minutes of moderate to vigorous physical activity today, and almost none of them met a 60-minute target for daily physical activity. The Texas Education Agency also recently reported that as children in Texas moved from elementary to high school, their fitness levels dropped substantially. The data clearly show that many kids are living an inactive lifestyle, spending more time in front of the computer and TV, that their neighborhoods are less walkable, that they have less downtime to pursue fitness-related activities, and that physical education and physical activity opportunities in the schools are reduced. You all recognize that the world that our children are growing up in today is just very different than the world we grew up in with regard to opportunities and requirements for physical activity. To stem the rise in obesity, it's imperative that children and youth become physically active during the school day. Children are to get 60 minutes of physical activity daily. It's hard to imagine how they will meet that target if they're not physically active at a reasonable level during the school day. Children and youth spend more time in schools than any other setting except their homes. In the past, schools played a central role in providing physical activity. PE has been an institution in American schools since the late 1800s, and school sports have been a growing component of the educational enterprise since the early 1900s. In addition, children have engaged in physical activity during recess breaks, during the school day, and by walking or riding bikes to and from school. The Dietary Guidelines for Americans, the American Heart Association recommend that children engage in physical activity for at least 1 hour on most days of the week, and the recently released report of the Department of Health and Human Services Physical Activity Guidelines Advisory Committee concluded that participation in 60 minutes of physical activity per day provides very important health benefits to children and adolescents. The AHA has been joined by the Centers for Disease Control and Prevention, National Association for Sport, Physical Education, and a number of other leading authorities in recommending that elementary school students receive 150 minutes of physical education per week, and that middle and high school students receive 225 minutes per week. However, the most recent School Health Policies and Programs study, recent 2006, found that only 3.8% of elementary, 7.9% of middle, and 2.1% of high schools are meeting those standards. More than 1 in 5 schools do not require students to take physical education at all. Additionally, only 45% of schools offer opportunities for students to participate in intramural activities or physical activity clubs. Only 1/3 of trips to school under 1 mile in distance and less than 3% of trips under 2 miles in distance are made by walking or biking. Even recess has been reduced or eliminated in some elementary schools. Reducing physical education and physical activity during the school day may actually undermine a school's ability to meet academic standards. A new field of research is providing very encouraging evidence that physical activity may help with brain function and development, and other recent studies have found a positive correlation between aerobic fitness and academic performance. Also, it's true that normal weight children have lower rates of school absenteeism than overweight kids. Schools are uniquely positioned to address childhood obesity and should be encouraged to ensure that kids are active during the school day. This is why the American Heart Association supports the Fit Kids Act. It is, in my view, critical that our schools be held accountable for delivery of high-quality physical education programs and for provision of healthy school environments. Further, it is critical that parents be informed regarding the status of their children's schools in these important areas. I believe the Fit Kids Act will help ensure that those outcomes result. I thank you very much again for inviting me to testify today, and when the time comes, I'll be delighted to respond to questions. Thank you.